Hello. I'd like to continue on with the environmental type of injuries and talk about drowning now. Well, there's SpongeBob. Actually, I wanted to talk to you about near drowning. Drowning means that the patient is dead. It's a completed event. So if someone comes in as a drowning victim, that means they're already dead. So really what we want to discuss here is near drowning. Patients that have gotten into the water and didn't die, but have symptoms of their exposure to the water. All right. What are the predisposing features for drowning? Who drowns? Well, you could imagine that drugs and alcohol play a significant effect. Occasionally, you'll have someone that simply has a seizure when they're in the pool or in the lake. You'll have patients that experience any other cardiovascular catastrophe like myocardial infarction. And we all have heard stories of people with cramps in the legs and unable to swim to shore. Certainly not knowing your environment, if there's offshore currents pushing you out to sea, you're more likely to have a drowning or near drowning experience. So about 3,300 people died in the water in any given year, and there's over 15,000 near drownings. So there's going to be a question or two on this on the boards. You can imagine this occurs more commonly if you're a boater, you're around the water, and more common with males. But not all drownings happen on the lakes and the oceans and the swimming pools. Don't leave kids unattended in the bathtub. And young children can be curious and fall into just the pail of water that you're using to wash the floor and drown. Okay? People with epilepsy should be advised not to take baths. They should take showers. So if they have a seizure, they're not going to drown. Now, you would think that the mechanism of action of drowning is like water in the lungs. But really, there are two types of drowning. There is something called dry drowning, and then there's aspiration drowning. Dry drowning means that there is no water that ever goes down into the pulmonary tree. These patients basically die of laryngospasm. The protective reflex to prevent water from going into the lungs is so great that the patients basically asphyxiate from a closed airway rather than let water go down into the pulmonary tree. Okay? The patients that aspirate and have near drowning or drowning, those can be further subdivided into two subcategories: freshwater and seawater. Freshwater is hypotonic, seawater is hypertonic. Now, the distinction is somewhat artificial because the final common pathway is the same. You die from hypoxia and hypercarbia, right, in both cases. But the mechanisms are a little bit slightly different in what the autopsy will look like and how you treat them. There's some subtle differences. So let's go over it. With fresh water, the water goes into the lungs, and what happens is that this water now diffuses out of the lungs into the bloodstream. So the patients are hypervolemic, too much circulating blood volume. All right? The surfactant is washed away from the lung, from the alveoli, so there's a lot of atelectasis, an ARDS-like picture. And at autopsy, then there'll be very little water in the lung. So what this indicates is that these patients probably are not going to need a lot of IV fluids given that they don't eat a lot of normal saline or lactated ringers. They're not dehydrated, but they may have serum and electrolyte abnormalities. Patients who have hypertonic drowning, they drown in the ocean, right? The water enters the lungs, and what happens here, since it's so salty, is the water leaves the blood vessels and joins the water that's already in the lungs from the ocean. So the lungs are very heavy, the alveoli are filled with water. At autopsy, there's a lot of water in the lungs. If you have one of these patients that survive, these patients are probably hypovolemic. They need normal saline or lactated ringers given because a lot of their blood volume, a lot of the water from their bloodstream has entered the lungs. Okay, so you have to watch out for the currents when you're on the beach. Besides, you have to watch out for the sharks, I guess. Here's another nice beach scene. So here's a picture of someone warning about children can fall into buckets and drown. All too common, unfortunately. So what are near drowning victims going to look like? Remember, this is not just for drowning, I'm going to tell you here. This is for everything. If the patient's agitated, think that they're hypoxic until proven otherwise. Listen to their lungs. See if they tell you what the color of the nail beds are. See if they give you a pulse oximetry reading in the question. If the patients are lethargic, you're thinking that they're hypercarbic, their PCO2 is high. That means they're hypoventilating, right? Okay? All right. So we're going to get blood gases on these patients and check their pH, their PO2, their carbon dioxide. All right? Patients with near drowning may have cough, tachypnea, right? Rales rhonchi. They could be coughing up frothy sputum, right? Depending on the degree of hypoxia and the length of the time they had anoxic encephalopathy, they're going to be a little confused or just frankly comatose. So what's the treatment? Okay, move them from the water. Great. Airway, breathing, circulation. Great. Oxygen. Great. Intubation if they need. Absolutely. Now what do you do if you've done all these steps and the patient's intubated and they're on 100% oxygen, and they're still hypoxic? Their lungs are so damaged that you still cannot oxygenate the patient. What's the next step? Well, you're already doing positive pressure ventilation for the intubation. You can add CPAP, continuous positive airway pressure, to your ventilator, and this will help correct the hypoxia and the acidemia that follows the hypoxia. All right? So it's give oxygen. If that doesn't work, intubate the patient for positive pressure ventilation. If they're still hypoxic, add CPAP. That's the sequence of events to get their oxygenation adequate in the near drowning victim. Okay, so you'll get blood gases. We'll do pulse oximetry. We'll do a chest x-ray, of course. And, go ahead and order electrolytes on these patients. Why? Well, we talked about the freshwater drowning or near drowning. May show hyponatremia, may show hyperkalemia on the electrolytes. So you want to correct the acid-base balance in electrolytes. So electrolytes I would get on all near drowning victims. ARDS syndrome, the washed out surfactant from a near drowning case, might not occur initially. So if you have anyone with any symptoms at all from a near drowning experience, they're just coughing a little, they're maybe just tiny bit tachypnic, they're breathing 20, observe these patients for 24 hours. Don't let them go. The only patients who can go home without being observed for a day is an exposure to the water that was very trivial. They never really had a near drowning experience. Once you have the diagnosis of near drowning and you have the most minor of symptoms, you need to be watched because that dyspnea and that ARDS is going to develop slowly over hours. A chest x-ray taken a half hour, an hour after the near drowning episode that's normal does not clear the patient. So follow the history and the symptoms that they have and watch the patient in the hospital for a day. Okay, now things that we don't do for drowning is we don't give prophylactic antibiotics. We wait for the patients to develop clinical pneumonia and then treat appropriately. We do not give steroids empirically. Okay? No steroids. All right? We all have seen the cartoons where they push on the chest to make the water come out the mouth in someone that has near drowning. We don't do that. All right? If the patient does have water in the airway and you hear that gurgling sound, you just use the standard suction catheter like you would do in any intensive care unit to remove sputum or secretions. Thank you very much. That's the presentation on drowning. Now you're ready for the test.